Tell me ready.
Ready.
All right. So today we're going to look at the bones of the appendicular skeleton. And just to be clear, last week we did the axial skeleton, right, which was the skull and the vertebra and the ribs and the clavicle. We had, I think, in there. We also had that's all we had. Okay, so pretty much the appendicular skeleton is everything else. It's the bones of the limbs, upper limbs and lower limbs, in both upper and lower extremities, the foot and the hand, and the girdles that are with each of those extremities. So a girdle is how the extremity attaches to the trunk. So if you look here, this here is the sacromacoccyx. I was trying to remember. Here is the axial skeleton, right? But the pelvis is part of the appendicular skeleton, and that's because the pelvis is the structure that takes the lower extremity and attaches it to the trunk. In the upper extremity, it would be the scapula. That attaches the humerus to the trunk. Okay. So let's look at the pelvis first. So the pelvis is kind of cool because there's actually 3 bones on each side that are put together. It makes it look like one bone, but it's really 3 different bones that start off. This big bone here is called the ilium. It's I-L-I-U-M. Then we have the ischium, which is the bone down here, and the pubis, which is this piece right here. Okay. Now, you really can't tell on this particular skeleton, but if you were to take a line and draw it across the pubis, up the ischium, and down the ilium, those 3 lines would meet right here. And this structure is called the acetabulum. And the acetabulum is for the head of the femur. Okay? So it fits right in here, makes a ball and socket joint. Okay. Now, if you recall from like day 1 or around there, you learned that the body has cavities, and the thorax is separated from the abdomen by the diaphragm. Then we have the abdominal cavity and then the pelvic cavity underneath. But there's no separation, physical separation, between the pelvic cavity and the abdominal cavity. Okay, that's not like a sign that says "Welcome to the pelvis," population 1, right? Whereas in the thorax, you have to cross the diaphragm to get down below, right? Here, so if you look at this pelvis here, there has to be some sort of artificial border that we can use to separate the 2 cavities. Okay, so it's not a physical border, but it's kind of a border that we use in our mind. And the border is this structure right here. If you follow this structure, this ring right here, this is called the pelvic brim. Okay, and the pelvic brim separates what's down here and what's up top. What's up top is really part of the abdomen. But because this is the pelvis, it kind of looks like it belongs in the pelvis, right? This little section, this area right here. So we call this the false pelvis. And the area inferior to the pelvic brim is the true pelvis, where your reproductive organs are, your bladder, and the things you normally associate with the pelvis is found down here. Okay? So when we are thinking and studying where these organs are located, when you get down here, you have to kind of be aware of what their relationship to this pelvic brim. Okay? All right, now, this pelvis has many parts to it. As you can see, there are lots of openings. There are bumps and crests and all. Remember from all the words that we studied. So what you should be able to do by looking at just the pelvis is, one, identify all the bones, but then identify the parts of each bone, each landmark, like we did last week. And then we're going to put in a little extra part of this. You should be able to look at this eventually and tell me if this is a male or a female pelvis. Okay. So what do you think is the difference between a male and a female pelvis?
The female, I think, is the middle part, probably.
The female has to be wider, and why is that?
Because of childbearing.
Right. So if I have my two pelvises here, okay, and I have my little baby head, right? If the baby's head can fit through, it's a female, and if it can't fit through, it's a male. Okay? Now, in about 5 minutes, we'll see what that means and how we decide that. But I want you to look at this structure right here, this angle. See this angle here? In the female, this angle is wider, it's bigger than in the male. Okay? So in mathematics, we would call it an acute angle less than 90 degrees in the male. In the female, it's closer to 90 degrees or even larger, as some people have. Right? So the wider this is, separates the two sides even more, giving more room. Okay? All right, so let's look. Here's the ilium. And this is the bone that when you put your hands on your hips to when you get mad at somebody, right? This is what you're touching, right? So this is called the iliac crest, and it has a border in the front and a border in the back. See, there's a bump here, and there's a bump down here. The bump on top is called the anterior superior iliac spine. And for short, we say ASIS. Okay? Anterior, remember, this is the front, right? So this is the anterior side. Out of the two of these, this is the top one, superior. It's on the ilium, so it's iliac. And this region right here, this sharp edge, is called the spine. Okay? It's just called the iliac crest, and at the end of the crest is the spine. Okay? So we have the ASIS and the AIIS, anterior inferior iliac spine. Okay? This here again is the pelvic brim. It's also called the pectineal line. This is the iliac tuberosity. This thicker bump right here. Okay. On the back of it, so the posterior side, you also have two. You may see better from the side here. You see a top one and a bottom one. So this would be the posterior superior iliac spine, and this is the posterior inferior iliac spine. So PSIS and PIIS. Okay? There's never a PISS. Just to let you know. That was funny, come on. Holy moly. All right, so looking at it from the lateral side, you see this big notch right here. And this is called the greater sciatic notch. You've all heard of your sciatic nerve. We'll study that towards the end of the semester. But as the sciatic nerve comes down off the spinal cord, it goes through here and down to the lower extremity. Okay? So there are two of them, a big one and a little one. A big one and a little one. This is the greater sciatic notch, and this would be the lesser sciatic notch. This is the pubis, the pubic bone, and at the edge of the pubic bone here, there's a bump on either side. These bumps are called the pubic tubercles. Now, there's a structure that attaches from the anterior superior iliac spine all the way to the pubic tubercle, and that's called the inguinal ligament. So if you think about that, the ligament would be like this, right? And anything that has to get to the lower extremity or to the scrotum, if you're a guy, kind of goes underneath this. It goes down that way, okay, or down that way if you're going into the scrotum. Okay, this structure here is called the pubic symphysis. It's a fibrocartilaginous joint that is pretty strong, but when the baby is delivered, it separates, which I assume is one of the reasons why it hurts so much to have a baby. It's been a while since I had one, so I don't remember. All right, but when this tears, I assume that's one of the reasons why there's so much screaming going on. All right, so
Does it go back?
it heals back. It heals back eventually. Yeah. All right, so now, still on the lateral side here, we have this big opening. Okay. Here, this side. This bone with the big bump here is called the ischium, and the big bump is called the ischial tuberosity. The ischial tuberosity, its claim to fame is that's what you sit on when you sit down. Okay. The hole here, the opening, this is called the obturator foramen. Remember, foramen is a hole, an opening, and obturator, the obturator nerve, the obturator artery, there's lots of structures that pass through here to get to their final location. Okay. This is the top of the sacrum. Remember, the sacrum was part of the exoskeleton from last time, and this kind of what would fit right on top of here? What bone would you find right here?
The vertebra.
No, the spinal cord is not a bone. The spinal cord's a collection of nerves, right? What bone sits on top of this?
Vertebrae?
Which one?
Sacrum?
Well, this is the sacrum, right? This is the sacrum.
What bones?
So what bone sits on top of it? Go back to your spot. Go back to your. What's the order? What's the order of?
The lumbar vertebra?
Which one?
Out.
How many cervicals are there?
L5. 7.
7 cervical. How many?
12.
12 thoracic.
5.
5 lumbar. So L5 has to sit on top of that. Okay. This edge that juts out is called a promontory, and it kind of makes sense because it's kind of prominent, right? And the joint between the sacrum and the ilium is called the sacroiliac joint, and it's a very common place for certain kinds of arthritis to affect, especially if it's like an autoimmune kind of arthritis. What else?
I have a question.
Yes.
When you get a hip replacement, what part is replaced?
It depends upon the actual operation. You could have a whole hip replaced, which would mean they would replace this and this, or it could be a hemi, which means half, only one side is replaced. So they may they may replace this but keep this if it's not affected, or they may take this if it's affected and not this, depending upon what the findings are in the exam. Okay, but they're metal. Yeah, you've never seen a metal joint? We may have one here somewhere. I'll look. All right, so let's. Any further question on this? The last thing here is this kind of scoop shape, right? Remember what we call this? What's the name of the structure?
Fossa.
A fossa. Very good. So, what bone is this? This is the ilium. So this would be the iliac fossa. Okay. Now, be really careful, because there are 2 iliums in our body. This one is the bone, ilium, but when you get to AMP2, you'll study the ilium as well, but you'll study the ilium that's on the intestines. So the ileum that's part of the small intestine is spelled I-L-E-U-M. So if you want to tell somebody that you're describing the bone, you got to use the right spelling. Because if you use I-L-E-U-M, we're going to think you're talking about the intestine, right? So that's where spelling counts on a test. Okay. All right.
Are you
Yes.
going 100% on the spelling when we take the test? Or
For ileum, yes. The rest of them, I'm not sure.
For the whole test.
Listen, if you're gonna be a nurse, and you need to know how to spell these parts of the body. So, if it's so far off that I can't figure out what it is, you're not gonna get any credit. If it's spelt wrong, but I can still figure out what it is.
Like by one letter or something.
If it's spelt wrong, but I can still figure out what it is, and it's correct,
Mhm.
you'll lose half points.
Okay.
But you're gonna lose something if you don't spell it right.
Okay.
Okay, that's just part of the process. All right, any questions about the pelvis? I think we covered that. Okay, so going distally, the head of the femur is smooth, and it makes again the joint with the acetabulum of the pelvis. And here you can actually tell. You see this line right here? See that line? That's that epiphyseal line, where the growth plate used to be. When bones grow, long bones especially. Remember we talked about the other day that bones come in pieces in the baby, right? So this bone actually starts off as 3 parts. This piece here, then this big piece here, and then this piece down here. And they're separated when they're developing because that's where the growth is. But as soon as the bone stops growing, we don't need that space anymore. That space is not really space, it's cartilage. Remember hyaline cartilage. But cartilage doesn't show up in x-rays. So when you look at an x-ray of a developing bone, you'll see 3 parts with what looks like empty space between them. But it's really not empty, it's just cartilaginous. But when we don't need the cartilage anymore because the bone is finished growing, then they fuse together. And that plate, the epiphyseal plate, becomes the epiphyseal line. Okay? So if you see the line, that means the bone has stopped growing. If you see the plate, it's still growing. Okay? So the head, here's the body, and there are these 2 bumps, big bump, one here and one here. So looking at it from the front, you see the big bump here. Looking at it from the back, you see not only the big bump, you also see the small one. Okay? The way you can tell front from back is this goes into the pelvis, right? You only can go into the pelvis one way. And this piece right here, see this smooth area right on the front? This is called the patellar surface. The patella is your kneecap. So the kneecap sits right on top of that. Matter of fact, the kneecap only attaches to the femur. It doesn't attach to the bony attachment to the tibia. Okay? So once you see this patellar surface, and you put this medially, because this has to point inward, right? You can tell if it's a right or a left. Right? If you put it in like this, you say this is a left one, that's not going to be correct because this is the back of the bone. So you have to have it in the right orientation. Okay, and that's how you tell any of these bones right from left. You figure out, which is the front, which is the back, and put it where it should be in anatomical position, and you can figure it out. Okay, so this big bump and this little bump, or smaller bump, are called trochanters. This is the greater trochanter. This is the lesser trochanter. These trochanters are the femur is the only place you find these trochanters. And size in anatomy, I know this is going to sound weird, but size in anatomy counts. Because the names of structures are based upon their size sometimes. For example, a little bump is a tubercle. A medium bump is a tuberosity. And a big bump is a trochanter. Right? So if you call a little bump a trochanter, that's not going to make any sense. So these are like the biggest ones. So these are the trochanters, greater and lesser. Okay, and if you notice, there's a line and a groove right here between them. Okay, so what do you think this structure is called? It's between the two. So what prefix do we use for between?
Is it tuberosity?
Between, for between. These are both tuberosities. I mean, these are both trochanters, right? So how do we describe between the tuberosities? What word would we use?
Medial?
No. Inter. Intertrochanteric would be between the trochanters. Intertrochanteric. Right? Interosseous would be between the bones. Intermediate, between two structures in the middle. Right? So this would be called the intertrochanteric line or crest, depending upon where it is. Okay. Now, if you look at the back, you see another line. It's this big, rough line right here. That is called the linea alba. And the linea alba will separate at the distal end and attach to the sides of the distal aspect of the femur. Right? What do we call a round articular surface? A large round articular surface. What's the name we use for that? Anyone?
Condyle?
Condyle. Excellent. So if we're looking at this, and this is, now we know this is going to be a right-sided bone, right? This would be the lateral condyle, and this would be the medial condyle. Right? Now, what do we call something that is on top of something else? So, like the skin that's on top of the dermis is called the epidermis. So the prefix epi means on top of, or superficial to. So, use your imagination here. This is another bump here. There's another round surface here on either side of the condyles. So these are on the condyles. So these are the epicondyles, because they're on top of the condyles. So again, this would be the medial epicondyle and the lateral epicondyle. This here is the patellar surface where the patella sits. Now when you get a chance to play with the patella, you'll see that it only fits in one place. It only fits. Do you have one over there? Is there one in the bag? Yeah, perfect. So when you look at this, the patella is a triangular bone. Right? There's a point, and then there's on the back side of it, there's a big and a small articular surface. And if you notice here, there's a big and a small articular surface on here too. So guess what? They fit together, right? See that? Right, so and that's the kneecap. Okay. Now you can tell if this is a right or a left also. If you take the point, face it away from you, the side that it leans on is the side that it belongs to. So this would be a right-sided one. If it leaned like that, it would be a left-sided one. And that's because the way that the large and the small articular surfaces are. Okay. Alrighty. Moving along. Did all that. And now we are going to the patella. Now let's look at the tibia. So this bone. Okay. This is another one that's easy to figure out if it's right or left. Okay. This is the distal end of it, and this is the proximal end of it. The proximal end has two round structures there too, and you can kind of imagine that they fit nicely, right? It also has a bump on the front, right here. And remember, a medium-sized bump is called a tuberosity. And this is the tibia, so this is called the tibial tuberosity. So the tibial tuberosity is in the front. And this little guy right here, this like point that's sticking out, this is called the medial malleolus. It's the medial bone of your ankle. So when you feel your ankle, you feel that bump, that's what that is. So if this is on the medial side and this is the front, this has to be a right-sided bone. Right?
Is the bone here? That one?
Well, that's the lateral one. That's the other side. So that bone
Your fibula.
is the fibula. Right? So that bone is like this. So that
This is
bone
the
on
bone.
that is this one, and on the inside of your ankle is this one.
Oh, okay.
Okay, and when you put when your foot is in here, this is the joint where the ankle actually flexes and extends. Right? No foot. Oh, you have the foot. So it just happens that this is a right-sided foot as well. So this is perfect, right? This would articulate like that and like that. Okay, and then here's your flexion and extension. Okay, we'll talk about the foot a little bit later. All right, so tibial tuberosity, medial malleolus is the name of the structure, and on the fibula, it's called the lateral malleolus. Lateral, medial. Okay. These are called the medial and lateral condyles on top because they go with the medial and lateral condyles of the femur. And if you could look closely, you see the one side of the fibula has like a point, a sharp point, and one is kind of a dull end. Right? This is the end. That's the malleolus. Right? And then actually the lateral malleolus actually goes a little more distal than the medial. Okay? Now, we don't know if these are from the same body, but let's make believe they are. What do you notice about the position of the fibula? On the proximal end. What do you notice about how I'm holding the fibula against the tibia?
Longer than
The proximal, so look at the top. How, don't fall. How, I'm probably not explaining it right, or at least I'm asking the question right. But there's something about up here that I want you to notice. What isn't it part of?
What?
What isn't it part of?
Does it really look like it attaches to that bone?
Well, it does, but it attaches down here.
Yeah.
It's not part of the knee. Notice how it's below the knee?
Yeah.
Which is why this is a non-weight bearing bone.
Non what?
Non-weight bearing. In other words, when you step down, all your weight is in this bone. Tiny, 0.000 something is on this bone. So we'll just call this non-weight bearing. Right. All right, so that because it's not part of that knee joint.
What would happen if we didn't have a fibula?
All the muscles on the lateral side of your leg would wouldn't have any place to attach to.
We wouldn't be able to move.
You wouldn't be able to move your foot in different certain positions. If those muscles weren't working, in other words, on the lateral side, right? When those muscles pull up, you're pulling the foot in that direction, right? And when these muscles on the medial side, they pull in that direction. Front pulls this way, and back pulls that way. So if you don't have a whole compartment of muscles, you lose a lot of motion. All right, now. Moving along. We're at the foot. You can easily tell which is the right and left foot, hopefully. How can you tell? The big toe, that's right, and hopefully your big toe is medial, all right? What else do you notice about the